10 or 15 years ago, if you're a woman looking for hormone replacement therapy, especially bioidentical hormones, it was almost impossible to find a doctor who would offer it. Most physicians at the time were not even trained in that area. And to be honest, there was a lot of fear and misunderstanding, especially after the Big Women's Health Initiative study. That study, which was terminated early, linked hormones to cancers, blood clots, and heart disease. But what most people did not realize at the time is that it only looked at synthetic hormones, not bioidentical hormones. But unfortunately, the damage was done, and it scared doctors and patients away from all forms of hormonal therapy for so many years. But times have changed. Over the last decade or so, even more than that, new research and education have shown us that bioidentical hormones are very different from synthetic hormones. More doctors are seeking out advanced training. At the same time, women are coming in educated, asking about this therapy specifically for themselves. Speaking from our experience in Southwest Florida, especially where we practice at Naples Longevity Clinic in Naples, I've seen a huge surge in women who are seeking this therapy. They're coming in educated, well informed about the huge health benefits related to bioidentical hormonal replacement therapy. To mention some of the benefits of bioidentical hormones, let's talk about bone health. Estrogen helps preserve bone density and reduces the risk of fractures, which, if they happen, these fractures, they can be really life altering, if not life threatening. If we want to talk about heart and vascular health, we can discuss this subject for so many days and yet not give it justice. Loss of estrogen after menopause accelerates plaque buildup, raising the risk for heart disease, strokes, and dementia. Skin health. Estrogen maintains collagen, elastin, and skin hydration, keeping the skin firm and youthful. Big benefit. So before spending thousands of dollars on temporary aesthetic procedures or creams, which I'm not discrediting at all, it is worth asking, are you addressing the foundation of the problem? Of course, hormone therapy is not one size fits all. Some women may have higher risks, for example. If there's a strong family or personal history of breast cancer, we're much more cautious. Blood clot risk is also a consideration, and the route of estrogen delivery, like topical versus oral, can make a difference. Blood levels are usually monitored 2 to 3 times a year. If side effects or other concerns arise, we check it more frequently. But we do not really rely only on blood work. We use symptoms as a gauge of progress, and if needed, we utilize imaging studies to determine the course of action and the next steps. The reality is, bioidentical hormonal replacement therapy is becoming more and more available, more than ever. And women are demanding it, rightfully so, because they want more control over their health, aging, and quality of life. If you're curious about whether bioidentical hormone replacement therapy is right for you, I highly encourage you sit down with a physician who truly understands the difference between synthetic and bioidentical hormones, who can walk you through the risks, benefits, and personalize a plan for you. I am Dr. Tara Cater from Naples Longevity Clinic, and if you want more science-based conversations about health, hormones, longevity, please make sure to subscribe to our Longevity Lab and share this video. Together, we can cut through the noise and focus on what actually works.